Welcome to my channel, Dr. Shahnawaz. In this video, I will talk about the achalasia. We should know that what is achalasia and the esophageal disorders. Actually, this is the first part, and in other parts, I will talk the approach and the treatment of the achalasia. Here we just see the introduction to the achalasia. Actually, the achalasia is the absence of relaxation of lower esophageal sphincter. Look at this picture that the lower esophageal sphincter is constricted and there is no ability to relax. And the esophageal motility disorder like the spasm or leak, these things may also cause the motility disorder due to which the achalasia may be persistent. And the achalasia is characterized by the insufficient lower esophageal relaxation, means the lower esophageal sphincter is constricted and the efficiency of the lower esophageal sphincter is not well because of the uh, innervation problems. Look at this that the esophageal peristalsis is lost, like there is no peristalsis up to the esophagus. Look, there is no peristalsis movement present because of the constricted esophageal sphincter. What are the causes of the achalasia? Mostly the cause is unknown, like idiopathic causes, and the autoimmune is most important because in some autoimmune diseases like the amyloidosis or choroiditis, the achalasia may be caused. Infectious factors may cause inflammation, because of which the muscles of the lower esophageal sphincter are affected and the innervation may be impaired. Some degenerative disorders may cause the degenerations to the muscle fibers of the esophageal sphincter, and there may be less ability of the sphincters to relax. And the other less causes may be the hereditary causes of the achalasia. What we see in the physiopathology, actually, there is loss of postganglionic inhibitory neurons, because of which nitric oxide may not be present, or the vasoactive intestinal polypeptide, that is named VIP, that is the inhibitory molecule. And in the absence of this molecule, the acetylcholine continue releasing, and there is constant and continuous contraction of the esophageal sphincter. In the postganglionic cholinergic neurons, we see there is no presence of inhibitory neurons that may lead to the unopposed cholinergic stimulation, because of which the lower esophageal sphincter is constricted. And continuing the physiopathology, we see that due to the constriction of the sphincter, there is high basal lower esophageal pressure, means the lower esophageal compartment of the esophagus is hypertonic, and there is insufficient lower esophageal relaxation. Because of the nitric oxide absence, the peristalsis may present, and the esophageal body may not be able to move, and there may be absence of movements, because of which the esophageal body is filled with the food and other gaseous particles. Look at this that we see the clinical presentations of the achalasia. We see that most important causes are the dysphagia for solid and liquid. In previous videos, I just talked about this that in achalasia, we see the dysphagia for both solid and liquid food particles. The regurgitation is also important because when there is no food entrance in the stomach and the food just is filled all in the esophageal body, and the food may be regurgitated, and we can vomit, or there may be some projectile movement of the food which we have ingested. And because of the problem in the esophagus, there may be chest pain in the patient. Continuing the clinical presentations, we see that the patient which present with cervical or xiphoid areal pains, we see that maybe some achalasia. And initially, the dysphagia may be for solids only, but it can go further for solids and liquids when we see that there is progression of the disease. 75% of achalasia patients may present with regurgitation, and others become a greater problem, like the esophagus dilate, and because of which there is hypertonic pressure, and food may be regurgitate. The choking, the coughing, like these things may awaken the patient from the sleep, and only 40% may present with chest pain and weight loss in 60%. I just finished the presentations of the achalasia, and almost the first part is end. And thank you.